They call it the hospital, but to me, it is a cage of terror. It begins the moment we enter. The smell is the first betrayal, not the sweet, familiar scent of home, but a sickening, sterile stink, a chemical reminder of pain and fear, and the ones who never came back. My paws are ice on the cold, white tile. Every sound is a gunshot, the screech of a chair, the inhuman whine of another creature trapped in a hallway. The echoing voices that belong to the giants who hold you down. They call them the doctors, but all I know is the sudden, cold touch of their hands, hands that grab, hands that prick, hands that demand submission. Every check, every exam, is an intrusion into my world, a silent, terrifying promise that I am completely, utterly helpless. This is not a visit, this is an ordeal, but what if it didn't have to be? But before we continue, here is a little promise. Like and subscribe, because today's insights might actually be able to change the way how your dog bonds with you, in a very positive way. When choosing a veterinary team or considering a new veterinarian, consider inquiring about their approach to minimizing fear and stress during appointments. Many veterinarians and staff members are trained in programs such as fear-free and low-stress handling, which aim to create a behavior-friendly environment using minimal restraint. These practices focus on making a behavior-friendly atmosphere and using minimal restraint methods, since many dogs do better with less restraint. For physical exams, vaccinations, and blood draws, often these clinics will attempt to limit noise that could stress out pets, play calming music, examine dogs on the floor, where they feel less stressed, instead of on an exam table, and more. A happy visit refers to taking your dog to the vet on a day when they do not need medical treatment, just a visit to the building to create positive associations before or between scheduled appointments. The best time to start this process is during puppyhood, but it is equally beneficial for adult dogs. Start with small steps, such as giving your dog treats in the car or parking lot outside the veterinary hospital. Call ahead to ensure the clinic isn't too busy, and ask if a staff member can greet your dog with treats outside. Gradually, work toward bringing your dog inside the building to continue rewarding them with treats. Moving at your dog's pace helps reinforce that positive experiences occur when they visit the veterinary clinic. Dog guardians can practice similar handling techniques commonly used by veterinarians and groomers at home. The goal is for dogs to learn to be comfortable with this type of handling in a stress-free environment. Practice handling your dog's paws, ears, mouth, and other body parts, while offering treats as rewards. Puppyhood is the ideal time to teach comfort with handling, but dogs can learn at any age. Never force your dog to accept touch or handling. Always allow them to walk away if they are uncomfortable or unwilling to participate. If they walk away, it is information that the training needs to be in smaller, slower steps before progressing. If you're unsure how to begin, speak with your veterinarian or a qualified trainer who uses humane practices. In some cases, working with a veterinary behaviorist may provide additional support to help address your dog's fear, anxiety, and stress. A basket muzzle is a helpful tool for introducing and training your dog to be comfortable wearing. These humane tools can facilitate less handling and restraint, which often minimizes fear and creates more safety for everyone handling your pet. When appropriately introduced, your dog will associate the basket muzzle with food and good things, instead of a scary experience. On the day of your veterinary visit, bring your dog's favorite treats from home. Opt for small, soft treats that can be broken into smaller pieces and given throughout the appointment. You might also consider bringing a frozen rubber, hollow treat dispenser like Kong dispenser, or a flat rubber textured mat like Lickimat, filled with your dog's favorite spreadable snacks for extra distraction. Enjoying tasty treats can help form a more positive association. If your dog stops eating or refuses treats, it often indicates their stress levels are too high, and you and your veterinary care team may need to make adjustments in their experience. For many dogs with pre-existing fear or anxiety, anti-anxiety medications can be beneficial when given at home a few hours before a veterinary visit. Not only can high levels of fear and stress in your dog negatively affect their overall health, but it often hinders your veterinarian's ability to conduct a proper examination and provide medical care. A dog's welfare and behavior can significantly improve by giving anti-anxiety medications before stressful events. Speak to your veterinarian if you think anti-anxiety medication may benefit your dog before their next visit. Waiting rooms can increase stress due to the array of sounds, sights, and smells. While you may not have control over the wait time, especially during emergency visits, you can minimize your dog's anxiety by waiting in a quieter area, such as outside or in the car, if this is a less stressful environment for them. Sometimes, scheduled procedures cannot be completed that day. If your dog's fear and stress escalate during the visit, if the procedure is medically necessary, advocate for alternative methods, such as sedation, to ensure your dog's comfort during the procedure. Dogs are experts in emotional contagion. They mirror the emotional state of their guardians. If you are stressed, tense, or anxious about the upcoming visit, your dog will often register this through subtle cues like the tightness in your grip on the leash, the change in your breathing, or your elevated heart rate. Your anxiety can act as a trigger, signaling to your dog that the environment is unsafe, even before you step inside the clinic. So before you even leave the house, engage in a brief, calming ritual. This might be 5 minutes of deep breathing, listening to quiet music, or simply sitting silently with your dog. The goal is to stabilize your nervous system so that you can project calm and confidence. Adopt the acting role, for example, during the visit. Consciously focus on appearing relaxed. Even if you don't feel it, use a slightly lower, softer vocal tone and keep the leash loose. Think of yourself as an actor portraying a relaxed owner. This allows your dog to focus on the positive treats rather than your internal tension. Do preemptive distraction, like if you find yourself getting anxious in the waiting area. Use the opportunity to actively reward your dog with treats and gentle petting, distracting yourself from worrying about the wait time. By actively engaging with your dog, you refocus your energy and project a beneficial, task-oriented calmness.